Welcome to the channel, which is Gene Sheen, and in this lecture I'm going to give you the description about the IVF, which is in vitro fertilization. In this lecture I'm going to give you details about the IVF, that what is IVF and why it is done. And after the why part, I'm going to tell you how the IVF is done, and also with the ending of the video with the risk of the IVF, because it's a humanly induced system, which we are interfering in the human biology. So it has some risk. It is not just IVF is full of glitters. It has some risks. So it's a very short video. I'm not going to give you a long video. It's going to be very short, about 25 minutes. The duration is going to be 25 minutes, and in this lecture I'm going to give you the enough details, so that which you can use in your university examination and other any examination if the question asks from the IVF. Okay, and it is in a very sequential form, and it is enough information. Okay, it is not unnecessary, too much of unnecessary information. Okay, so we start from the in vitro fertilization. That what is in vitro fertilization? So the in vitro fertilization, which is also called IVF in the short, is a process of fertilization where an egg is combined with the sperm outside the body in vitro glass. Okay, so IVF is a process. It's just like a RDT. It's don't have a one step. It has a lot of steps. So it's a process. It's not a one step way. Okay, so it's a process of fertilization where an egg, the female egg, the ova, is combined with the sperm, but the fertilization occurring outside, the combination is occurring outside the female body and in vitro condition. It means the outside condition in a glass tube. Okay, the process involves, so what are the involved what are the processes which is involved in this IVF? So the first one is monitoring and the stimulation of a woman ovulatory phases or processes. So what are the processes involved in the IVF? So the first one is we monitor the eggs, and we monitor the woman's body and the eggs, and then we stimulate the woman, so that the ovulatory process will begin. So the first one is the first process which involves in the IVF is the monitoring and stimulation of woman ovulatory process. The second one is removing an ovum or ova from the woman ovaries and letting sperm fertilize. Okay, so the first one is monitoring and stimulating the woman ovulatory process. The first one is removing ovum or ova. We're going to remove multiple eggs, not the single eggs. We're going to see in later. Okay, and then after the retrieval of the woman egg, we're going to let the sperm fertilize them in a liquid in a laboratory. Okay, after the fertilization, when the zygote is formed, undergoes embryo culture. So after the fertilization, the first one is monitoring and stimulating the woman ovulatory process. The second one is retrieval of the woman, multiple eggs of the woman, and then the third is the sperm fertilization, ovaries and sperm fertilize, and then we have embryo culture. Okay, and the embryo culture is about 2 to 6 days, and after that 2 to 6 days, when the embryo culture is completed, it is implanted in the same or another woman uterus. So the benefit of IVF is you can implant the embryo which you culture in the same, or if the woman having some uterine problems, then you can you can implant those embryo to the another woman womb or uterus also, with the intention of establishing a successful pregnancy. Then we're going to see why it's done. Why what are the causes why we are doing IVF? Okay, there are always a reason. So IVF is a treatment. It's a treatment. Okay, IVF is a treatment for infertility or genetic disorder. So IVF means in vitro fertilization. It comes as a treatment or a genetic problems. Okay, it's going to treat the, if you have some infertility, if the woman or the men have some kind of infertility or genetic problems, it is for that. It is for the treatment. Sometimes IVF is offered as a primary treatment for infertility women infertile in women over age 40. So sometimes IVF is offered as a primary treatment for infertility in women over age 40. So when the woman crosses the age after the 30, then she has some biological issues. The body is not giving full support for the conceive. Okay. IVF can also be done for certain health conditions. So we see why we are doing the IVF, because it's a treatment for the infertility or genetic disorders, and there are other health conditions in which we are doing the IVF. So there are around 8 to 9 conditions in which we are doing in a general way. Okay. So the first one is if the fallopian tube is damaged or blocked. So if the fallopian tube is having some damage or blockage, then this problem makes it difficult for an egg to be fertilized or for an embryo to travel to the uterus. So if the fallopian tube is damaged or if the fallopian tube is blocked, then it is difficult for the egg to reach. It is difficult for the sperm to reach and get fertilized and form embryo. So these problems make it difficult for an egg to be fertilized or for an embryo to travel to the uterus. Okay. Then the second problem in which we doing IVF, why we are doing IVF. So apart from infertility genetic problems, we have some if the woman having some fallopian tube or blockage, then we are doing it. Then the second one is ovulation disorder. If the woman is having some ovulation disorder, if the ovulation is infrequent, it is not frequent or absent, or the fewer eggs are available for the fertilization, so which is going to reduce the chances of pregnancy. Okay. So if the woman is having some ovulation disorder, it's going to reduce the chances of the pregnancy. Okay. The third one is why we are doing the IVF is the endometriosis. So it occurs when the uterine tissue implants and grow outside the uterus, often affecting the function of ovaries, uterus and fallopian tubes, all among them. Okay. So it's just like an ectopic pregnancy when the implant is grow outside the uterus. Okay. So this is the endometriosis, and it affects the uterus, the fallopian tube, and the ovaries. Okay. So endometriosis, if there is endometriosis, then IVF is a good choice to be. It occur, and if we talk about the endometriosis, it occurs when the uterine tissue implants and grow outside the uterus, just like the ectopic pregnancy. Then we have uterine fibroids. Whatever I talked about is the problems in the female. If the female have these problems, so if the female have some blockage and damage in their uterine tube, fallopian tube, if she having some ovulation disorder, if there is endometriosis or ectopic pregnancy, if she having a uterine fibroids. What are uterine fibroids? So fibroids are benign tumor. These are not the malignant tumors, but they are the benign tumors. Okay. In the wall of the uterus. So if the woman is having uterine fibroids, means they are the benign tumor. It means they are the potent tumors in the future in the wall of the uterus, are common in the women in the age of 30s and 40s. So uterine fibrosis is very common in the women uterine wall in the age of 30 and 40, as their biology become weaker and weaker as they age. These can interfere with the implant of the fertilized egg. So if the woman having fibroids in their uterus, it creates problem for the implant. It's going to interfere with the implant, because we know that cancerous is like a ghost, eat all the resources around. Then these are the 4 problems, and whatever problems we see is problems in the female. So that's why we do IVF. Now another 4 problems we talk about is that previous tubal sterilization or removal. So if the woman having previously sterilization, generally the tubectomy, then IVF would be a good choice. So what is happening is that previous tube sterilization or removal, what we're going to do is that if one having a tubal ligation tubectomy, in which her fallopian tubes or the uterine tubes are cut or blocked to permanently prevent pregnancy. So at that time the couples decided to we don't want pregnancy, and they're having some sterilization, the tubectomy, and now they want to conceive, then IVF may be alternate to tubal ligation reversal. Then the sixth problem is that why we are doing IVF is that impaired sperm production or the function. These are the problem. This is the problem of the male. Those above we talk about, this five problems are in the females. If the fallopian tube is blocked or damaged, if she has some ovulation disorder, endometriosis, uterine fibrosis, then if she is having some tubectomy, previous tubal sterilization. Now we sixth point we going to see that why we are doing IVF is that if impaired sperm production or function, it means below average sperm or spermatozoa production or weak movement or the motility of the sperm. If the sperm is not motile enough to reach to the eggs, or the abnormality in the morphology of the sperm, means the size and the shape can make it difficult for a sperm to fertilize an egg. If and it is not just about the sperm, if the semen also have some abnormalities, if the seminal fluid have some abnormalities, it going to affect the fertilization. Okay. Then the seventh point is that if a genetic disorder, okay, if the family having a genetic disorder, if one and his and these problems can be in the both the male and the female, male and female and the both. Okay. So genetic disorder, if one and his her partner is at risk of passing on a genetic disorder to the child, so if there are chances of passing a genetic disorder to the child, he she may be candidate for a pre-implantation genetic testing. So she or he candidate good candidate for pre-implantation genetic testing, means before the implantation there is a genetic testing to determine, okay, a procedure that involves IVF. So the pre-implantation genetic testing requires IVF after the egg is harvested and fertilized. So when the egg is retrieved and when we fertilize with the sperm, they are screened, okay, and for a certain genetic problems, and embryos which don't contain identified problems can be transferred to the uterus. Okay, so that is why also IVF is done if they having some genetic disorders, and this is applicable for the male and female also. So what is happening is that screening of the embryos is happening, in which the doctors seeing the the symptoms of genetic problems. If they see something related to genetic problems, if the embryos poses those characteristics, then they are removed, and the fresh embryos which don't identify with such problems, because it is not mandatory that it is going to inherit those genetic disorder. So those embryos who do not inherit those identified problems are then transferred to the woman uterus, uterine lining, and it is good, and that is why IVF is done. Then another is the fertility preservation for cancer or other health condition. So if the woman is having some health condition, if the woman is going through some health condition, then in which if she is having some treatment, for example the cancer treatment, then she is having their eggs frozen out, okay, and she may be used to have implantation in a later future. Okay, so the ninth point is that fertility preservation for cancer or other health conditions. If one is about to start cancer treatment, if the woman is about to having a cancer treatment, for example the radiation or the chemotherapy, that could harm her fertility, ultimately the progeny, IVF may be an option. Women can have eggs harvested from their ovaries. So in this procedure, women can harvest their egg from the ovaries and frozen in an unfertilized state. So the eggs are going to be frozen in unfertilized state for later use, or the eggs can be fertilized and frozen as embryo for future use. So either the eggs are frozen, or the sperm and eggs are fertilized and embryos are frozen for the future use. Women who don't have a functional uterus, and the next point is if the women don't have a functional uterus, or the if the uterus is not of the good quality and it going to hamper the health of the woman, then it is also not a good thing to conceive at your own. She may choose another donor, gestation carrier for that. Okay, so what we see, the first one is, see if the fallopian tube has blockage, damage. We see the ovulatory disorder, endometriosis, and then we have uterine fibrosis, then we have use IVF, then we have sterilization, tubectomy, then we have impaired sperm production or the function, in which we see the below average production, morphology problem. Okay, we have, if the genetic disorder, then the good one is screen out. If the female is about to have some treatment health conditions, then in which the either the eggs are frozen or the eggs and sperm are fertilized and the embryos are frozen for the future use, and if the woman is not having a functional uterus. Okay, next we this is the why we are doing IVF. Next we talk about the steps involved in IVF. What are the steps? So the first step is ovarian stimulation or induction. Okay, so the first step is the ovarian stimulation. We're going to stimulate the ovaries, we're going to induce the ovary. Okay, then we have the after the stimulation after the induction with the hormones, we going to retrieve the female eggs, then we have sperm egg retrieval, then we're going to perform the fertilization, then we have, if needed, embryo culture for the screening, then we have embryo transfer and implantation. So what are the steps? The ovarian stimulation and induction. The second one is egg retrieval. After the induction and stimulation, the egg retrieval, then sperm egg retrieval, then we have fertilization, and if needed, embryo culture for the screening, and then we have embryo transfer and implantation. One cycle of IVF takes 2 to 3 weeks. So the one cycle of the IVF take 2 to 3 weeks, means 14 to 21 days. So if we talk about the very first step, that is ovarian induction, which is also known as ovarian stimulation, in which we are going to stimulate the ovaries with the synthetic hormones. If a woman using her own eggs during the IVF, at the start of the cycle, she begin treatment with synthetic hormones. So if the woman is going to use their own eggs, then she must have at the start of the cycle treated with some hormones, synthetic hormones, to stimulate their ovaries to produce multiple eggs. Okay, because we cannot depend on the natural stage of the ovulation, which produces one egg at a month. We need a multiple eggs, because some eggs are not going to be fertilized. So rather than the single egg that normally develops each month, multiple eggs are needed, because some eggs weren't fertilized or develop normally after fertilization. In the aspects, some medications are. So what are the medication for the ovarian stimulation, for the ovarian induction? We see, so there are sequence, the FSH, LH, then we have HCG for the maturation, then we have progesterone. Okay, then we're going to see the estrogen level in the blood. So these are the sequence. So what are the hormones? For the ovarian stimulation or the ovarian induction, we injected containing FSH and LH, or a combination of both. So we're going to inject either LH, FSH, or the combination of both, just like the contraceptive. They stimulate more than one egg to develop at the time. So we know that we're going to for the ovarian induction and stimulation, we're going to inject FSH and LH, follicle stimulating hormone and luteinizing hormone. FSH is going to be the from name indicate follicular stimulating hormone. It's going to stimulate the follicles to be matured, and LH is the ovulatory role. Okay, so the synthetic, we're going to give synthetic jab of FSH and LH to the woman. And for the oocyte maturation, after the LH, FSH, for the oocyte maturation, when the follicles are ready for retrieval, after the stimulation, when the eggs are ready for the retrieval, generally after 9 to 14 days after the FSH LH injection, she has to take HCG for the help egg to mature. Okay, so the first hormone is FSH LH. Then after the 9 to 14 days, when the oocyte matures, okay, when the egg is about to retrieve, the HCG is also given, the synthetic HCG, human chorionic gonadotropin. Then after that, to prepare the lining of the uterus, because to implant those stuff, the embryo, you have a great lining of the uterus, and it is not natural, so you have to create artificial lining. It means it's going to be a natural process, but you have to induce those lining with the artificial mean. So to prepare the lining of the uterus on the day of egg retrieval, or at the time of embryo transfer, so to prepare the lining of the uterus at the day of egg retrieval after the induction of the HCG, or at the time of embryo transfer, the doctor might, not always, might recommend that she begins taking progesterone. We know that the progesterone is the pregnancy hormone supplements to make the lining of the uterus more respective for implantation, for the proliferation, for the maintenance of the uterine lining. We need the progesterone. Okay, it's a pregnancy hormone. Okay, so that the implant may conceive. Typically she need 1 to 2 weeks of the ovarian stimulation. So the ovarian stimulation means the LHH, FSH, LH, or HCG. Okay, and after that progesterone, the ovarian stimulation, it means the FSH and LH is going to be the dose is for the 1 to 2 weeks, and means 7 to 14 days before the eggs are ready for retrieval. Okay, so the dose of FSH and LH are given for the 7 to 14 days. To determine when the eggs are ready for collection, doctor will perform vaginal ultrasound to see the development of the follicles, or the blood test to measure the response of ovarian stimulation medication. Estrogen levels increase as follicles develop. Progesterone levels remain low until after ovulation. So after the stimulation or the ovarian induction, which is 1 to 2 weeks, the for the retrieval, when the woman is induced with the SCG, for the retrieval, doctors are going to be checked through two methods: the vaginal ultrasound, in which they can see the development of the follicles, and the second one is they're going to have a blood test, in which if the estrogen level is high, if the progesterone level is low before the retrieval or ovulation, then it is going to be indicated that yeah, we are on the right track. Next we talk about the egg retrieval. So the first one is ovarian stimulation or induction. We talk about next the egg retrieval. It can be done 34 to 36 hours after the final injection and before ovulation. So the egg retrieval is done can be done 34 to 36 hours after the final injection. Okay, stimulating injection and before ovulation. During egg retrieval, or sedative and given painkillers. So during the egg retrieval, women are going to have a sedative or a painkillers, because the retrieval of the egg involves the probe in the vagina to their ovaries, and in the probe there are suction pipe which has suction capabilities. So it's a little bit of painful process. So during the retrieval, the woman might have some sedative or a pain medication. Transvaginal ultrasound aspiration is the usual retrieval method. So what are the method for the egg retrieval? Which is the transvaginal ultrasound aspiration is the usual retrieval method. It means doctors also keep monitoring through the ultrasound. Okay, an ultrasound probe is inserted into the vagina to identify problems. So the first of all, the ultrasound probe is inserted into the vagina of the woman, to identify the follicles. Then in within from those probes, then a thin needle is inserted. After that, a thin needle is inserted after the probe, ultrasound probe, so that they identify the follicles. Once they identify the follicles, the thin needle is inserted through the vagina into the follicles to retrieve the egg, and which might be some painful. So that's why we have sedative and pain medications. So after the ultrasound probe is inserted and identified the follicles, the thin needle is inserted through the vagina into the follicles to retrieve the egg. Okay, the eggs are removed from the follicles through needle connected to a suction device. So the eggs are then sucked out from the needles. Okay, multiple eggs are removed in within the 20 minutes. And then we have the mature egg. Then we have that those eggs which are mature eggs are placed in a nutritive culture or a media and incubated for a while. Eggs that appear healthy and mature will be mixed with the sperm to attempt for fertilization. However, not all eggs may be successfully fertilized. Okay, next we have in vitro fertilization. There are some after the stimulation, after the egg retrieval, we have the sperm retrieval also. For the sperm retrieval, we're going to see that if the woman using her partner's sperm, she'll provide a semen sample at the doctor's clinic in the morning of egg retrieval. Other methods such as testicular aspiration, use of the needle to extract sperm directly from the testicles, are sometimes required. Donor sperm can also be used. Sperm are separated from the semen fluid in the lab. So for the sperm retrieval, what are the ways? So the seminal sample is connected, and then the sperm are retrieved from that. And the second thing is the testicular aspiration, in which the probe is inserted directly into the testicles and the sperms are ejected and suck out. Okay. And if the donor sperm can also be used for the sperm retrieval, donor sperm can also be used. The sperm are separated from the seminal fluid. Okay. Then we have fertilization after the stimulation of the woman ovary, the retrieval of woman egg, retrieval of male egg, sperm. Then we have fertilization. Fertilization can be attempted using two common methods. So there are two methods for the fertilization: the conventional insemination or intracytoplasmic sperm injection, which is also called ICSI. So for the fertilization, there are two methods. The first one is conventional methods, the old methods, and the second one is ICSI, intracytoplasmic sperm injection. ICSI, ICSI, intracytoplasmic sperm injection, ICSI. Okay. So if we talk about the conventional insemination, during the process, healthy sperm and mature egg are mixed and incubated overnight. So for the conventional insemination, fertilization, if we talk about the conventional insemination fertilization, the healthy sperm and mature eggs are mixed and incubated overnight. Okay. The second one is for the fertilization after the conventional method. We have intracytoplasmic sperm injection, which is ICSI. In this process, a single healthy sperm, only a single sperm which is healthy, morphologically fitted, is injected directly to the mature egg, and it is often used when sperm quality or number is a problem. So if there is a problem in the quality of the sperm, if there is a morphological problem, if there is a motility problem, then ICSI is used. Okay. Because the sperm don't have capability to penetrate into the eggs. Okay. So intracytoplasmic sperm injection, in this process, a single sperm is directly injected into the mature egg, and it is often used when semen quality or the number is a problem. Then at last, we have embryo transfer. After the fertilization, we have two conventional methods in which we left it for the overnight, ICSI. And then we have embryo transfer. Embryo transfer is done 2 to 5 days after the egg retrieval. When the egg is retrieved using aspiration, suction pull, after 2 to 5 days, the embryo transfer occur. And in between, the fertilization also occur. The woman might be given a mild sedative for the embryo transfer. For the egg retrieval, female egg retrieval, female also given sedative, and for the embryo transfer also female given a sedative. So sedative is given 2 times. So this one is a mild sedative. Okay. So for the retrieval of the egg, the woman is given sedative, and for the embryo transfer also, woman is given sedative. So the woman might be given a mild sedative. The doctor will insert a long, thin, flexible tube, which is also called catheter, into the patient vaginal through the cervix and into the uterus. So for the embryo transfer, the doctor insert a long catheter into the patient vaginal through the cervix and into the uterus. A syringe containing one or more embryos suspended in a small amount of fluid attached to the end of the catheter. Okay. So in the embryo transfer, women are given mild sedative, and after the mild sedative, the patient vaginal is inserted by catheter through the cervix to reach the uterus, and a syringe containing one or more embryo, which is embryo which we needed, suspended in a liquid amount of fluid, which is a nutritious fluid, is attached to the end of the catheter. Okay. Then we use the syringe. The doctor places the embryo into the uterus. So using the syringe, okay, in which the fluid and the embryo was there, the doctor places embryo into the uterus. Okay, if successful, if this is successful, implantation is the successful, embryo transfer is the successful into the uterine lining of the woman, an embryo will implant in the lining of the uterus about 6 to 10 days after the egg retrieval. Okay, result: after 12 weeks or 12 days or 2 weeks after egg retrieval, the doctor will test a sample of patient blood to detect the pregnancy. Okay, so after that embryo transfer, 2 weeks later, around 12 to 14 days, the doctor is going to having a blood test to detect pregnancy is occur or not. If pregnancy occur, the doctor will refer her to other pregnancy specialist for parental care. Okay, so if pregnancy occurs, the doctor will refer her to other pregnancy specialist doctor which for the parental care. And the details they're going to share: the pregnancy doesn't occur. If the pregnancy doesn't occur, she'll stop taking progesterone, which is a pregnancy hormone. The doctor might suggest step she can take to improve the chances of getting pregnant through the another cycle of IVF, which is take 12 days. Okay, 12 to 21 and 2 to 4 weeks. Okay, so if the pregnancy doesn't occur, then the doctor advised to not have take progesterone, which is pregnancy hormones, and suggested to to repeat the cycle again. Okay, so the cycle what we read is that the first is the ovarian stimulation, egg retrieval, which is a painful bit. Then we have sperm egg retrieval. Then we have after the retrieval we have some fertilization, two types, conventional and the ICSI. And then we have a transfer, embryo transfer. Okay, and after that in embryo transfer, after the embryo transfer we have two options result after the blood test. We have, if the pregnancy occurred, the women are sent to another doctor specialist, pregnancy specialist doctor, for the parental care. And if doesn't occur, the cycle repeats and women must stop taking the progesterone pills. And now we talk about the what are the risk of the IVF. Okay, what are the risk of the IVF? So if we talk about the risk of the IVF, multiple births. So this is the risk of the IVF, which is important for the examination. Multiple birth is the risk of the IVF. IVF increases risk of multiple birth if more than one embryo are transferred to the uterus. So multiple birth is a risk of the IVF in which the more than one embryos are transferred to the uterus. The second one is premature delivery and the low birth weight. So it is very often in the IVF that the baby is premature. Okay, the delivery is premature. The first one is multiple birth. The second one is premature delivery or low birth weight. IVF slightly increases the risk that the baby will born early or with a low weight. So with the help of IVF, the baby is born early, premature delivery, and she's having or he having a low weight. Okay, overall weight. The third problem with the IVF, the first one is multiple birth. Okay, the second one is premature delivery, which is harmful for the baby. The third one is ovarian hyperstimulation syndrome. So if we continuously give FSH, LH, HCG, progesterone, then it going to create ovarian hyperstimulation syndrome. Ovarian hyperstimulation syndrome, because we are stimulating ovary again and again, so it creates ovarian hyperstimulation syndrome. Use of injectable fertility drug, i.e. HCG, to induce ovulation can cause ovarian hyperstimulation syndrome, in which the ovaries become swollen and painful. Symptoms include mild abdominal pain, bloating, nausea, vomiting, diarrhea. So this is the problems of IVF, that ovarian hyperstimulation syndrome. The very much use of the HCG going to blot or swell the ovaries, and it is going to be painful. And the symptoms are abdominal pain, bloating around the gone area, nausea, vomiting, and diarrhea. So ovarian hyper syndrome is also going to be the risk of the IVF. Then the fourth one is the miscarriage rate is high in the IVF. The rate of miscarriage for women who conceive through IVF with fresh embryo is similar to that of the women who conceive naturally, about 15 to 25%, but the rate increases with maternal age. So as the age is going up, the miscarriages chances up. Egg retrieval procedure complications. So the retrieval of the egg is the complicated procedure. It's a painful procedure also. So this is also a risk Use of an aspirating needle to collect eggs could possibly causes bleeding, infection, or damage to the bowel, bladder, or blood vessel. Risks are also associated with sedation and anesthesia if used. So if egg retrieval process are complicated and the use of the needles sometimes causes bleeding, infection, damage, and to the damage to the bowel, the bladder, or blood vessels, and the risk are also associated with sedation and the anesthesia if used. The sixth point is why we are what are the risk of the IVF is ectopic pregnancy. About 2 to 5% of women who use IVF will have an ectopic pregnancy. It means the fertilized egg implant outside the uterus, usually the fallopian tube. The fertilized egg can't survive outside the uterus, and there's no way to continue the pregnancy. Okay, it creates problem to the woman and the baby also. Okay, because the baby is not going to be there. Okay, if it is implanted other than the uterus in ectopic pregnancy. Birth defects. So this is also the problem of the IVF, that the baby, the fetus which get birth, is having some birth defects. The age of the mother is the primary risk factor in the development of the birth defect. So as the woman age grow up, there are so the woman, due to the woman age, if she age more than 30 and 40, then she must be the primary risk factor in the development of the birth defects of the baby. Septal heart defect, cleft lips with or without cleft plate, esophageal atresia or atresia. Okay, so if the mother age is more than 30 to 40, then she going to have a primary risk factor for the birth defects. For example, septal heart. Okay, and then cleft lips, यहाँ पे कट रहता है, so cleft lips also going to be the problem. Or IVF include ICSI is associated with an increased risk of imprinting disorders including Prader's, Wills syndromes, and Engelsmann syndrome. Okay, so IVF include ICSI, intracytoplasmic sperm injection, is associated with an increased risk of imprinting disorders. Imprinting disorders including Prader, Willis syndrome, and Engelsmann syndrome. Okay, because it's the IVF includes ICSI. Okay, so it has some disorders, and the last problems risk of the IVF is that spread of the infectious disease. For example, hepatitis B and HIV. ETC may be transmitted through IVF when sperm are from unknown donor. So if the sperm are from the unknown donor, then the hepatitis B, HIV is going to be transmitted if not screened out. So what are the risks of the IVF? The first one is multiple birth. The second one is premature delivery of the baby. The third one is hyperstimulation of the ovarian hyperstimulation syndrome. The fourth one is miscarriage. The fifth one is egg retrieval, which is a complicated process, causes bleeding and all. Then we see this ectopic pregnancy is also a problem. Then we have birth defects. If the woman is a primary risk more than 30 to 40 years, then we have spread of infectious disease, HIV or hepatitis B, अगर unknown donor से आ रहा है तो. So what are the risks? So the first risk is multiple births. The second risk of IVF is premature delivery. Okay, the third risk is ovarian hyperstimulation syndrome. The fourth risk is miscarriage. The fifth risk is premature. The fifth risk is egg retrieval procedure are complicated, जिसकी वजह से bleeding हो सकती है, infection हो सकता है, damage हो सकता है blood vessels, bladder, और यहाँ पे anesthesia and sedation देना पड़ता है. Okay, ectopic pregnancy is also a problem. Okay, then we have birth defects, and then we have spreading of infectious diseases. So I'm going to summarize you that what is IVF. That we take the egg from the female and we monitor, stimulate the egg from the female. Then we have fertilized that egg with the sperm. Then we have embryo culture to 2 to 6 days. Then we going to implant it the same or another woman. Then why it's done? Because to treatment of the infertility or genetic problems. The first problem is in the woman fallopian tube get blocked or damaged. The second is if she is having some ovarian disorders, fewer eggs are, so the chances of pregnancy is low. Endometriosis, then we have uterine fibrosis, benign tumor interfere with the implantation. Then why we are doing is that key prevents previous tubal sterilization, is she's having some previous sterilization. Then we see that why IVF is done is impaired sperm production, morphology, motility. Then we see the genetic disorder, then we're going to screen out and use the best one. Okay. Then we see the fertility preservation, for if she's the woman is having some treatment, then she going to freeze the eggs or freeze the embryo and then use in the later. Okay. And if the human don't have the functional uterine, it's going to affect the woman and the child as well. Then we see the steps. So the first one is ovarian stimulation, the second one is egg retrieval, the third one is sperm retrieval, the fourth one is fertilization, embryo culture, and the embryo transfer. Or in embryo induction, we see the synthetic hormones are induced. And what are the hormones? FSH, LH, and then for the maturation, HCG, and then for the preparation of the lining of the uterus, we uses the progesterone, which is the pregnancy hormone. And then after 1 to 2 weeks ovarian stimulation, we for the egg retrieval, we see the vaginal ultrasound to see the development of the follicles. And then we see doctors see blood test for the rise level of the estrogen levels in the blood, so that they can know, yeah, the egg is ready for the retrieve. For the egg retrieval, we see that woman is given sedative and the pain medications. And transvaginal ultrasound aspiration is the method. Transvaginal ultrasound aspiration is the method. Firstly, the ultrasound probe is inserted into the vagina through the uterus, cervix and vagina to identify follicles. And then a thin needle is inserted through vagina into the follicles to retrieve the egg. And then needle is going to be suck out all the eggs, and multiple eggs are going to be there in the 20 minutes. And then mature eggs are going to be laid down in the culture media, incubated. And then we have sperm retrieval. A sperm retrieval are going to be from the semen sample or the testicular aspiration. The same needle is going to be inserted and directly from the aspirated the sperm from the testicles. And if the donor is also there, then donor sperm can be used. And there is a key that the semen fluid is separated from the sperm. Then we have fertilization, in which we have two methods: the conventional method, in which we mix and leave it for the overnight. And then we have ICSI, intracytoplasmic sperm injection, in which a single sperm is injected to the directly to the mature egg. Is when a semen if there is a problem in the semen quality, the number, then it is used. And then we have embryo transfer, in which also we have given some sedative and mild sedative, and catheter is being used through the cervix. It is going to be in the uterus. A syringe containing embryos, one or more embryos in the fluid attached to the end of the catheter, and it is going to be the place inside the uterus. And then we have see the result. The result are two: if the pregnancy occurs, the doctor refers to the pregnancy specialist, and if doesn't occur, the cycle is going to be repeat. And what are the risks? We see the multiple birth as a risk, the premature delivery, ovarian hyperstimulation syndrome, we see the miscarriage, we see the complications of the egg retrieval, the painful procedure, bleeding, also occur, infection, damage. We see the ectopic pregnancy is going to be the problem. Okay, we see the birth defects is higher as the woman is old. And we see the spread of infectious disease if the donor is from the unknown. So thank you, and this is all about the IVF, that is in vitro fertilization. Thank you.